right, everyone. Welcome back to all my listeners. This is episode 17 in season 14. Today is Wednesday, April 23rd, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys. So I hope you're having a really delightful month of April. I sure am. As I am recording this episode, the weather has finally warmed up. The trees in this region are finally starting to bloom for spring. So those light pink, light cream-colored flowers are blooming on trees, just gorgeous. Some people have their daffodils up and blooming. There are some tulips that are starting to bud. Anyway, it is just gorgeous up here finally, but we are in for some more cold and some more rain this coming weekend. So it is what it is, but I'm very happy. So I hope you guys are all doing really, really well, wherever it is you are. So anyways, you guys, welcome back to another episode. So in today's Newsworthy, I'm going to be featuring a pretty exciting week here for health information professionals. It's called HIP Week, and it is a celebration for all of us that work in this space. So I just wanted to give some shout outs and talk about it briefly in Newsworthy. And then, of course, in my trusty tip, I wanted to highlight a lot of issues that I am still seeing in documentation I receive and review from chiropractors. And of course, I'm going to go ahead and close out and round out today's episode with another remarkable quote on change by Oprah Winfrey. All right, you guys, let's get into it. So in today's Newsworthy, this is a big one. This is a big week in particular for health information professionals. It's HIP Week, HIP. Stands for Health Information Professionals. Now, AHIMA recognizes this week and encourages organizations to celebrate the teams they have in place, those superheroes that play a crucial role in ensuring that health information is accurate, complete, and available to patients and providers alike. So, do you know exactly who health information professionals are? Who are they, and what do they do? Well, AHIMA made a terrific informational FAQ sheet that tells us exactly who they are. Now, health information professionals are those experts who keep healthcare running smoothly. From hospitals and clinics to insurance companies and tech firms, they ensure health data is accurate, secure, and accessible, helping providers make informed decisions and improving patient care. Now, how do health information professionals support healthcare? Well, AHIMA tells us that health information professionals bridge the gap between healthcare, technology, and data. They work alongside doctors, nurses, labs, and pharmacies to ensure that patient records are correct, complete, and protected. Their expertise in data management helps organizations improve efficiency, enhance patient safety, and meet compliance standards. Now, what do health information professionals do? Well, depending on their role, there are so many things that health information professionals might do. They might be analyzing health data to support smarter decision-making. They also might be designing and implementing systems to track patient care and outcomes. They may also ensure compliance with healthcare privacy and security regulations. They could also be involved in improving workflows to enhance efficiency and reducing costs. And finally, health information professionals might also be collaborating across departments to help streamline processes and protect patient information. So, of course, where do some of these health information professionals work? Well, health information professionals are in demand across hospital systems, clinics, insurance companies, government agencies, law firms, and tech companies. So whether they're managing patient records or leading compliance efforts, even analyzing data, they play a key role in keeping healthcare systems running effectively. Common job titles include medical records specialist, clinical data manager, data scientist, health information technician, medical and health services manager. Now, outside of AHIMA, there are many other professional organizations and credentialing bodies that support and celebrate and recognize the hard work of health information professionals, like the AAPC, AMBA, NAMUS, HCCA, and PMI, to name a few. So a big shout out to all my dear friends and colleagues out there in this space, so many of whom I've featured here on the podcast over the years. Now, we are committed to seeing the next wave of incredible health information professionals join the club. And now it's time for my best practice tips in Trusty Tip. So I know I addressed chiropractors and their insufficient documentation in a CBR or comparative billing report in a past season of the podcast. But here we are again in 2025. I am still seeing documentation deficiencies for chiropractic manipulative treatment services, those things called CMT services. Now, there are just a few codes that chiropractors can use for these types of CMT services. There's just a few, and they are CPT codes 98940, 98941, 98942, and 98943. That's it. Now, but it's important to know how many levels of the spine you are manipulating, because if you miscalculate, it can lead to inadvertently overcoding. So let's get specific. 98940 is for 1 to 2 levels of the spine. CPT code 98941 is for 3 to 4 levels of the spine. CPT code 98942 is for 5 regions. And finally, 98943 is for extra spinal 1 or more regions. So specifically, they're talking about the head or upper or lower extremities, the rib cage, or the pelvic region. So those things have to be identified in documentation, and you need to make sure that you're picking the correct code, again, based on that documentation. Now, Medicare and other payers have subluxation documentation requirements. So if you're asked to provide records, remember that you should be including documentation of subluxation that is shown by either an X-ray or by a physical examination. And that's where I see a lot of deficiencies and dings that I have to, unfortunately, deliver based on the records that I am seeing. There's a lot of fine points that are not included in the physical exam since there's no X-ray. So let's unpack some of these requirements. So when you're including documentation, you should include a CT scan if you performed one, or an MRI that shows the subluxation of the spine. Include documentation of your review of the X-ray, the MRI, or the CT, noting the level of subluxation. You should also include X-rays that are taken within 12 months before or 3 months following the beginning of treatment. In some cases of chronic subluxation, for example, in scoliosis patients, Medicare may accept an older X-ray if the patient's health record shows the condition existed longer than 12 months, and it's reasonable to conclude the condition is permanent. Or, this is what I'm talking about, in the case of documentation of subluxation shown by physical examination, your documentation must show at least 2 elements. And this is where I see some deficiencies. These 2 elements can include pain, asymmetry or misalignment, range of motion abnormality, tissue tone changes. So again, that's your part, your pain, asymmetry, misalignment, range of motion abnormality, and tissue tone changes, right? PART, including one that falls under asymmetry, misalignment, or range of motion abnormality. Include the dated documentation of the first evaluation. Include the primary diagnosis of subluxation, including the level of subluxation. Include any documentation supporting medical necessity, of course. So those physical exams that I've been seeing have just been the provider is palpating the spine, right, without any further details. So all that means is that they are simply touching them, right? They're not actually including any documentation of what their findings are for range of motion, that abnormal range of motion, right? If there's any misalignment that they're palpating, etc. So yes, a physical examination includes the palpation, obviously, but we need to include more detail on what are you finding in that physical examination, since you are not choosing to utilize the X-ray or the MRI or the CT type of technology for that particular patient's record. So that's a big one. That is one of the highlights that I have been seeing again and again in my documentation reviews. So it's really important that for these handful of codes that reflect CMT services, the documentation has to really be buttoned up. Also, you should be mindful to submit treatment plans for your chiropractic services. You should be documenting a treatment plan as you see this particular patient population. Now, this should include, as best practice in my recommendation, the frequency and duration of visits you're expected to see this patient, as well as specific treatment goals and objective measures to evaluate treatment effectiveness. And finally, I focus season 14's Spark on change. I want this 14th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their insights and their wisdom on change. So, in this week's inspiring quote in Spark is from Oprah Winfrey. We can't become what we need to be by remaining what we are. Absolutely true, right? This quote reminds us that we cannot remain stagnant. This quote shows us that to become more, we must change. We must grow. Otherwise, how can we improve? How can we elevate into someone greater? I'm happy Oprah Winfrey's spark still burns brightly and inspires so very many. All right, you guys, that wraps up today's episode. Now, I hope you found my trusty tips today on chiropractic documentation really, really helpful if you happen to be a chiropractor out there tuning in to the podcast today. I really think documentation should better support these types of services. There are so many people out there who require chiropractic services. I know many people who see their chiropractor all of the time. So this is a must to make sure that you hold on to your reimbursement. So anyways, you guys, I hope you guys have a lot of good, fun things in store for the upcoming weekend. I know I do. So thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.